So you got the flu, now what do you do? Dr. Rob coming to you here today. I'm going to be talking to you about my 3 favorite herbal/food supplements to take if you have the flu, or if it feels like you're getting the flu or you're getting a cold. And look, I'm going to ask you and implore you and beg you to please watch this till the very end. The last product that I'm going to talk about, or last herb food I'm going to talk about, is a fiber that has been shown clinically and even reported by WebMD to be used for things like cancer, liver disease, hepatitis, Lyme's disease, flu, viruses, all kinds of stuff. So please keep an eye out to the end. So the first one we're going to talk about is astragalus. Now, a report from the University of Maryland Medical Center stated that astragalus can be beneficial in cases of cancer, diabetes, but most importantly, it helps to prevent colds, flus, and upper respiratory infection by supporting and stimulating the immune system. Dr. Wheel actually recommends to take astragalus throughout cold and flu season to help prevent the onset of flu. Okay, so the dose for taking astragalus is usually about 250 milligrams to 500 milligrams of the whole herb. Me, for this particular route, I prefer to take the tincture, especially if you have any GI problems, leaky gut, or problems digesting things. I think the tincture for astragalus is much more easily absorbed in people. So my recommendation for that is 100 milligrams to 200 milligrams per day. There is some research that shows if you take large amounts of astragalus, and I think in the research it was like 25 grams, which no one takes, but still, if you take large amounts of astragalus, it could actually inhibit the function of the immune system. So I found a very effective dose as tinctures between 100 milligrams and 200 milligrams per day. All right, number 2 is got to be elderberry. So a study published in the National Library of Medicine reported that elderberry was shown to reduce cold symptoms and reduce cold duration. Another study that was done showed to reduce the intensity of symptoms related to the flu. And there was another study that was posted in the Journal of International Medicine Research, where it showed that taking 175 milligrams of elderberry 4 times per day while a person had the flu reduced the duration, or the time that they had the flu, by 4 days. So elderberry, definitely a strong number 2. Okay, so for number 3 here, we are breaking out the whiteboard, and what we're going to be talking about are what's called beta-glucans, specifically beta-1,3-glucan, which is a fiber that's found in different foods like mushrooms and celery. Beta-glucan is a really cool substance, and the way that we are thinking it works is the beta-1,3-glucan, this little fibrous substance, is absorbed into the bloodstream and it attaches itself to our white blood cell. So this is going to be the white blood cell. And when it attaches itself to the white blood cell, both are what are called macrophages and also our natural killer cells, it stimulates them. So it's almost like the beta-1,3-glucan is a trumpet sound that gets the troops going and fires them up and gets them into attack mode. Because the beta-1,3-glucan has been shown to help reduce colds, flus, and infections. So it's an awesome thing to take if you do have a cold or a flu. However, there's more. Beta-1,3-glucan was shown clinically based on a study that was published in PubMed.gov to do 3 great things to the human body to prevent the metastasis of cancer. The first thing it does is what's called cytotoxicity, meaning the beta-glucan attaches itself to the natural killer cells, which cause the natural killer cells and the other white blood cells in the body to find, seek, search, and destroy the cancer cells. The other thing it does is something that's called anti-angiogenesis, which is the prevention of blood cell formation to a tumor. Cancer cells need blood and nutrients, right? A cancer cell actually ingests 19 times more sugar than a regular cell, so definitely don't eat sugar, right? But regardless, they need blood. They need nutrients to survive. The beta-1,3-glucan prevents the development of the blood vessels to the cancerous tumor, which essentially prevents the tumor from growing and surviving. And the last thing that does that's really cool is what's called treatment restoration. When a person has gone through chemo or a person has gone through radiation, there's usually significant damage, or I shouldn't say usually, there's sometimes significant damage that's been done to the bone marrow. And the bone marrow is needed to produce both our white and red blood cells. And beta-1,3-glucan was shown to actually improve the ability of the bone marrow to manufacture its red blood cells, improving blood cell count, improving oxygenation to the cells and to the body, which is exactly what we need. So my top three are astragalus, elderberry, beta-1,3-glucan. Now you know about the other ones like echinacea and golden seal, and those things have been around forever, and everyone takes those, and you should. However, these are some that some people know about and some people don't. Again, astragalus and elderberry I like in a tincture form. Beta-1,3-glucan, you can take it in a tincture form or you can take it in the whole food form. Either one is perfectly fine. So if you enjoyed this information, I'm going to ask you please to share it with a friend or just post it online or share it online. There's a lot of people right now that are suffering with colds, suffering with flus this time of year. The information I'm giving you has been really researched and clinically studied. I've seen it effective with my own staff and my own patients in the office. Not that I'm claiming to treat the flu with herbs, because I'm not at all, not in the least bit. So if you found it beneficial, please share it, please, 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 and subscribe to my channel. And also, if you have a health or weight problem that you feel like you need some help with, I'm going to put a link right down here to my free online weight loss and health evaluation. That's a great tool that we use and is the first step in us understanding the potential underlying cause to a person's health or weight problem, right? So problems don't just exist on their own and kind of pop up. If you're overweight and you're having trouble losing weight, there's a reason. If you have a health problem and your body's not able to heal itself from the health problem, there's a reason. So let's work together. Let's find the reason. If you'd like my help, I'm here for you. I'd love to help you. So fill that out. And I will catch you at my next whiteboard session. See ya.